somebody who treats stroke, for those of you who are working with patients who have had hemorrhage, bleeding, aneurysms, or ischemic blockage in the brain, when you work with patients like that, you're going to find certain weaknesses. And when they're being treated in the typical medical model, you're going to find that they are getting basically just the feedback component from the joints and the muscles. They're just working with the joint, trying to get it straightened out. Whereas with functional neurology, you're trying to build neuroplasticity in the brain. So whatever was injured, you're trying to build back up around that area. Because neurons or nerves that wire together embryologically will fire together. So nerves that wire together fire together. And when one nerve fires and its sister cell is next to it, even if it's damaged, that when it draws in blood flow, that area can fire around it and rebuild this whole neuroplastic arena in there and build back up what was lost oftentimes. Now, the longer someone has had it, the less effective it's going to be, but even if someone had a stroke 5 or 10 years ago, even if the damage was way back when, that those nerves, those neurons can still rewire with each other. You can rebuild and regrow connections that were lost. Now, the nerves might be dead, but the connections can be regrown. So oftentimes when you work with feedback, you're missing out on the feed forward, let alone the efferent copy. The efferent copy is what's sending a message to the cerebellum while it's sending a message down. The feed forward is what goes from the cerebellum up to the brain. So the back part of the brain up to the front part of the brain. And they've been doing this for years in the neurological fields, functional neurology, where to rebuild the networks, because you get a feedback from the brain when you see the other side doing the activity, and the brain thinks it's the opposite side. You can actually get feedback from the joint that's involved without moving that joint. And it's pretty phenomenal when you work with these patients, because it's as simple as having them come in and treating them and getting their brain to rewire in a way that no one ever thought of before in the classic medical sense. So they're sitting there, and they've got a patient, and the damage is in the brain, and they're constantly just working the foot. So you get feedback from the foot or from the ankle, but they're missing out on the entire concept of feedback from the brain, because the brain fires back and forth different cycles, brain down to the thalamus, back up, brain down through the pontomedullary region into the cerebellum, back up, the dentato-rubrothalamocortical pathway, the pontomedullary pathways that go up and down, and the visual cortex that's watching what the body is doing. So I know it's a little bit confusing to explain to patients. That's why you have to simplify it down. You say there's a loop in the brain. Okay? There's several loops in the brain. They're everywhere. But if you can fire the loops in from the eyes and work the healthy part, and that can make the bad part work better, it's a little bit simpler that way. So you don't have to get all confusing with the DRTC, the dentato-rubrothalamocortical pathway. That doesn't matter except that you know it. So if the patient knows that the therapies you're giving to them, although they're on the same side that's healthy, can treat the side that's bad through the visual pathways, the visual cortex, and its loops up into the parietal and frontal lobes, that's all they need to know. And again, not even that technical. There's loops in the brain, and this is what I tell patients. There are loops in the brain. When they fire, they wire. Okay? So you can strengthen up parts or systems that aren't working by firing other areas. And it's really as simple as that.